9G, the menstrual cycle. The menstrual cycle is the periodic reproductive cycle that a woman experiences during their reproductive life. The cycle is roughly 28 days long and begins with a woman's menstruation or period and ends with the next appearance of her period. The menstrual cycle is controlled by a woman's fluctuating hormone levels during the 28-day cycle. It can be split into two components, the ovarian cycle and the uterine cycle. We will look at the effects of these hormonal fluctuations on the ovary and the uterus this lesson, and we will focus on the hormone levels themselves next lesson. The ovarian cycles are the events that occur in the ovary, principally egg maturation, while the uterine cycle includes the events that occur in the uterus in preparation for pregnancy. Both of these occur simultaneously and have an effect on one another. The ovarian cycle has 3 phases. Day 1 through 13 is called the follicular phase, where a follicle matures in the ovaries. Day 14 is ovulation, where the Graafian follicle in the ovary ruptures and releases the secondary oocyte into the fallopian tubes. Day 15 through 28 is called the luteal phase, in which the corpus luteum forms and secretes hormones to further prepare the woman and her uterus for pregnancy. If the egg is not fertilized, or if the fertilized zygote does not implant into the uterine wall by day 19, the corpus luteum will degenerate and the hormones that it secretes will diminish. Simultaneously in the uterus, the uterine cycle is taking place, which also is composed of 3 phases. Day 1 to day 5 is menstruation, where the lack of an implanted egg results in the endometrial lining of the uterus to break down and slough off. The uterine wall is highly vascularized, and if there is no pregnancy, there is an extreme constriction of the blood vessels, which cause the endometrium to detach and pass out through the vagina, which is observed as the menstrual period. Day 6 through day 14 sees the rebuilding of the endometrial layer in preparation for the possible implantation of the next fertilized egg. Day 15 to day 28 is the secretory phase of the uterus, which coincides with the luteal phase of the ovaries. This phase sees further thickening and nourishment of the endometrial layer of the uterus. It is called the secretory phase, as the endometrium also begins to secrete nourishing chemicals, such as glycogen, proteins, and lipids. If conception does not occur, the endometrium will begin to secrete prostaglandins to trigger the uterus to contract, aiding in menstruation. As mentioned earlier, these 2 cycles are occurring simultaneously and begin with a woman's first appearance of her period. The follicular phase of the ovarian cycle coincides with menstruation and the proliferative phase of the uterine cycle. Ovulation is day 15 of the ovarian cycle, which is the last day of the proliferative phase of the uterine cycle. The luteal phase of the ovarian cycle runs from day 15 to day 28, which coincides with the secretory phase of the uterine cycle.